Have you ever wondered what a head-to-toe survey is and why it's crucial in emergency medicine? It's a comprehensive, systematic approach used to assess and manage patients, particularly those who are unconscious or injured. The head-to-toe survey ensures that no stone is left unturned and every part of the patient's body is thoroughly examined for injuries or abnormalities. Here's how it's done. Beginning with the head, look for signs of trauma, lacerations, swelling, or deformities. Don't forget to check the scalp for any wounds or tenderness. The eyes should be evaluated for pupil size, equality, and reaction to light. Feel the skull for any irregularities or fractures. Moving to the neck, look for tenderness, bruising, or deformities. Be on the lookout for signs of cervical spine injury. The trachea should be checked for midline position and signs of obstruction. Next, the chest. Inspect for visible injuries, listen to breath sounds on both sides, check for paradoxical chest movements, and ensure equal rise and fall of the chest with breathing. The abdomen is next. Feel for tenderness, rigidity, or masses. Look out for signs of internal bleeding and listen for bowel sounds in all quadrants. Next up, the pelvis. It should be stable with no signs of fracture. Apply gentle pressure to the iliac crest to detect any instability. Look for signs of pelvic tenderness or bruising. Inspect each limb for deformities, swelling, or injuries. Test motor and sensory functions in all extremities. Check for pulses distal to any suspected injury or deformity. Finally, the back. Look for signs of trauma. Feel the spine for tenderness, deformities, or step-offs. Check for signs of spinal cord injury. Now let's talk about the recovery position. If the patient is unconscious but breathing normally, this position maintains an open airway and prevents aspiration. Here's how to do it. Kneel beside the patient and straighten their legs. Position the arm nearest to you at a right angle to their body, with the elbow bent and the hand resting under the cheek. Grasp the far shoulder and hip and roll the patient toward you onto their side. Keep the head tilted back to keep the airway open. Ensure that the patient's upper leg is positioned to support their body, preventing them from rolling onto their stomach. Adjust the head position as needed to keep the airway clear. Keep a close eye on the patient while they're in the recovery position. Be ready to take further action if their condition changes. By conducting a thorough head-to-toe survey and positioning unconscious patients in the recovery position when appropriate, healthcare providers can swiftly identify injuries and provide the right care. This optimizes patient outcomes, ensuring everyone gets the best chance at recovery.